And the Kenya Union of Clinical Officers is demanding a resignation of the Health Cabinet Secretary, Director General of the Ministry, and the Chair of the Social Health Authority over failures that have been experienced with the new health insurance scheme. The clinical officers who have vowed to go on strike beginning Monday have decried exclusion from pre-authorization of SHA patients, yet they're manning over 1,000 facilities that they say SHA has failed to recognize.
For a clinical officer to be able to see a patient through the social health authority, the social health authority must recognize that clinical officer. How do they recognize them? They recognize them through empanelment. Empanelment is including them in the register of the recognized practitioners. By the dint that they didn't recognize the clinical officers council, then they cannot recognize the clinical officers because the registration and licensure comes from the clinical officers council.
Patients are not able to get outpatient services from a level 5 hospital with this insurance cover. And therefore, the private hospitals end up now offering these services to our patients. So we are a frustrated lot because we have patients who are suffering and they are not able to access care because we have not been allowed to offer services to patients who have been registered by the Social Health Authority.
The CS, the CEO, who I saw in the press the other day, the chair of the Social Health Authority, and the Director General, who is the highest ranked officer, who is the technical advisor to the government on matters of health. They are misleading the government and they are misleading Kenya. And in any case, they are the problem why Kenyans are complaining about the Social Health Authority. We do not celebrate going on strike, but a strike that has been orchestrated by the government and they are not willing to step back and enforce the law, we have no choice but to go on strike.